Great. Well, good afternoon, everybody, and welcome to the first in a series of Next in Health LinkedIn Live discussions. My name's Anthony Bruce and I chair Health Industries here at PwC. And we're delighted to be launching this series of LinkedIn Live discussions where we will explore some of the most pertinent issues in healthcare for the sector and actually for society at large. In this episode, we're focusing on the health of the nation, the health of the workforce and the wider population. And with economic inactivity at an all-time high, an aging workforce and mental health driving long-term sickness, how we maintain a healthy population and a healthy workforce, frankly, is a growing problem for businesses and for society and all of us, frankly. Today, we'll be exploring these issues with a really super panel. I'm delighted to be joined by Rachel Sylvester, a columnist from The Times and chair of the Times Health Commission, which is exploring some of the most urgent challenges facing health and social care in the UK. Dr. Abeyratne, the Director of Health Equality and Inclusion at the University Hospitals of Leicester NHS Trust. And finally, Karen Finlayson, a partner here at PwC in our government and health industries practice. Welcome to you all and thank you for joining us today.
Hi.
If I could come perhaps to you first, Rachel, around this economic inactivity point. And with inactivity at an all-time high, maintaining a healthy population and workforce is a growing problem for business and society, as I said. Our recent research for the Times Health Commission showed that since the pandemic, businesses have seen a significant increase in mental health issues, which is one of the main drivers of long-term sickness. Rachel, how big an issue is this for businesses in your opinion, and what are some of the issues driving that inactivity?
I think it's an absolutely huge issue. So the PwC survey of businesses that you did for the Times Health Commission was so fascinating and revealing. And one of the most striking statistics was that 59% of the companies say that long-term ill health is actually harming their economic performance. So at a time when productivity is a real problem for the country, businesses are really struggling for this, and there's a massive economic consequence for the nation as well as for companies. But the thing that slightly surprised me and I found really interesting was that the PwC survey for the Commission found that this is really being driven by mental ill health, at least as much as physical ill health, which the sort of musculoskeletal problems that have traditionally driven long-term sickness. So 40% of companies have seen an increase in employees taking long-term sick leave because of mental ill health. And 2/3 of employers report an increase in the use of counselling services. And I think this is in a way the long COVID, a long tail of the pandemic, that people partly taking their mental health more seriously, but also there is a sort of longer term consequence of the pandemic, and businesses are really paying the price as well as the country.
Yeah, I think that's a great point, and I think the business point, but also society at large, as you said. I guess coming to you, Roo, and focusing on those who do not have access to the same level of care is an important role in addressing that economic activity point that Rachel was referring to, as this could exacerbate health inequities across both local demographics and populations. Roo, how do we put in place services and interventions that work for everyone, frankly?
Yeah, thank you. It's such an important question. And I think what I need to do is go back to Rachel's point around the workforce and who it is that we're talking about. So one of the challenges that we have in healthcare is that we talk about our workforce and the populations that we look after as separate entities, and we have to start to bring them more into the same space. So the people who we're looking after are the people who we're caring for. So that would be my first point. We can't see them in isolation because it limits our perspective on the problem. But then I think underpinning that, there is a question around what is the problem? So being really specific about what is the inequality that you're trying to surface and using your local data to really pinpoint that in. So, for example, whether that's around access to mental health services, whether it's around access to rehab or other services, but being really specific about the problem, because what we know is that what works for one community in one service doesn't necessarily work for another community in the same service. And that goes to my third point around this. So once you've used the data and you've been really specific, it's then about engaging with the community in a way that is meaningful to them. So we talk about co-designing interventions. And what that really means is responding to what a community or a population tells you is at the heart of the problem. And that's challenging because that requires trust, which requires time to build. And we know that communities are telling us that trust is at an all-time low. We know that people are feeling disempowered and unable to advocate for themselves. So we've got to invest time as well as resource in building relationships with underserved communities, whether that is in our workplace, where we know we have underserved communities, or more broadly in the population. But I think we've got good evidence that it can be done and it does work. So I think it's time for optimism, but it's also time for action around that as well.
Couldn't agree more, and a great call to arms. Coming to you, Karen, around the sort of prevention rather than cure. We've heard from Rue and Rachel around the shifting the healthcare system to one perhaps more of prevention and empowering the population rather than just simply curing. Curing obviously has an important role here. That can support society and also a healthy and productive workforce, recognizing the point that the workforce and society are one and the same, of course. But is this going to take willing from both providers and patients, and probably, frankly, government to embrace this change? Karen, how do we start to turn the dial on prevention to address the important topics that Rachel and Rue have outlined there?
Yeah, thanks, Ant. That's a huge and a big question. And I do like the point about, our patients are also our workforce. They are the people, the communities that we serve. So, the NHS in the long-term plan have been talking about prevention for a long time. So it's not something that's new. But I think it's right in that it's been difficult to execute at pace. I do think the emergence of the ICSs, integrated care systems, is a great way of being able to have that better engagement with the different partnerships that exist within a local community. And Rue gave some great examples about how you need to build trust with a place and making sure that all the partners in that place are able to engage with the communities in a meaningful way to serve the population as a whole, but also those underrepresented or underserved populations within there. And so I think the ICS does present a great opportunity model to be able to address some of those issues. But some of the other points that I think is really important, and this is where sort of the patient or the public contract comes into play. We know that the NHS is unsustainable and in its current form from an affordability point of view. So I do think there's a huge sense of responsibility, and that is linked to sort of education. I think it's linked to how we work better with public services and through educating the sort of younger population around what does good healthcare look like for you, and how do you maintain that throughout your working career. So I think that's a really important part. The other part that we've talked about really is about employers. And again, I do think, employers have a fantastic opportunity and a great role to play in terms of keeping their workforce well, around screening, around support, around mental health support, and actually putting in place initiatives and programs that support their workforce to have healthier lifestyles. So I think that's also important. But the last point really is around the use of technology and making sure that actually, we know the younger generation engage with technology every day and on a daily basis. So I think being able to implement or think about programs about where they can self-manage better care, their own well-being and care, I think is an important opportunity that we should be able to embrace. So it's not an easy challenge. It's been there for a while, but I do think there's definitely opportunities to be able to work more on the prevention than the cure.
Perfect, thank you. And I think we'll come back to that technology point, because I think that has to be part of the answer and the solution here, both from a cost perspective, but also from a patient and community engagement perspective, and frankly access. Maybe coming to you, Rue, back around place, that prevention versus cure. How do we ensure that there's the focus on prevention is done in an inclusive way and a way that's accessible for all, in the way that Karen's talked about there, particularly for those that are harder to reach?
Yeah, thank you. So, I think it feels like prevention is at the heart of all of this, doesn't it? And where we've got a health service at the moment that is really reactive, and as a patient or a member of a community recently said to us, the NHS comes to us in crisis mode and expects us as a community to respond. Actually, they're telling us there that they want to be able to intervene and to work with us at an earlier stage in whatever the illness or the challenge is. And certainly as a geriatrician, I feel very invested in getting prevention right, because I see people right at the end of that journey where we've missed all of our opportunities to engage people in a conversation around prevention. So I think Cameron raised some really important points around centering on advocacy and self-advocacy. So enabling people to feel like they can advocate for their own health is a really important place for us to start before we get into the details of what is it that we're trying to prevent. And so what do we need to be doing to enable people to self-advocate? And it just goes back to that idea around knowing our local data and knowing our local population. So certainly in the trust I work in at the moment, we've taken our local and our most recent census data, and we've invested some time and some energy working with the university to really understand what does this mean for the health of our local population? What impact is migration having on that? What impact is access to employment having on that? And in a broad, wider determinants of health perspective.
Yeah.
But what that's enabled us to do is to pick out pockets of and groups within the local population who need us to be more proactive and intentional about the way we have conversations around prevention. So, for example, we are trying as a provider of acute care to put ourselves into the community in a local charity where we're talking about reducing alcohol intake, smoking cessation. We're trying to role model that through having the same conversations in our workplace, because as I said before, we know that colleagues go out to their communities and share information. They share the experiences they've had. So I wish that I could have a sort of a silver bullet, but I think a really important part of this is being able to define which group it is that you're trying to work with, and then going into that group and making yourself part of that community. And it's really compelling when the community tells you, we don't trust that you're going to do what you say you're going to do. So going back to what I said at the beginning, building that relationship and nurturing that two-way conversation on what is it that we're asking you to do and how are we going to help you to do that, rather than you need to stop smoking or you need to reduce your alcohol intake. Because what we know is that people who are struggling, people whose income isn't as good as it could be, it's much harder to change behavior when you've got external stresses and external pressures on you. So it's a really complex conversation, but I think it's one we need to unpick and get down to the detail of.
Yeah, I agree. And that point about, not all, you can't just paint the community as one type of patient. The absolute, the huge diversity of need and diversity of population means actually your point on listening is hugely important, but it also comes to how we use data and technology to really understand the difference in the communities that we're within and also that we serve. Yeah, fascinating. Karen, maybe that sort of picking up on that technology and the digital part there, as we see a digital revolution, we're all seeing artificial intelligence and ChatGPT in the news and on the television and the internet and so forth. With the emergence of AI into the broader consciousness and the marketplace, there's clearly opportunities presented for healthcare providers, frankly, to implement new technologies which can address that cost point that was discussed earlier, and also prevent ill health and disability, as well as really critically, we think, increasing access. But much more clearly needs to be done for providers and patients to embrace that change, whether that's about trust, access, or whatever it might be. Karen, maybe coming to you, this is a huge area, but what do you see as some of the challenges around technology transforming healthcare in the way that Karen and Rue and Rachel have outlined there?
Yeah, so first of all, I think I'll start with the positives on AI, because there's lots of cynicism, there's lots of talk about AI you know, even Rishi's gone over to America to see if we can be a sort of a leading edge in terms of generative AI. So it's on everybody's agenda. And I do think it offers a real opportunity, especially in healthcare, to sort of automate and solve some of those really important problems. And also it's about how we can increase productivity. So it's, you know, we know that productivity in the NHS has dropped by 15% post the pandemic. And also it provides an opportunity to compensate for where we've got skill shortages and enable us to do things quicker and faster. So I do think there's a great opportunity that shouldn't be missed in terms of the sort of AI revolution. I think it's also, though, thinking to keep in front of mind, despite the challenges, around how it improves the cost of care, it improves outcomes because things can be done quicker. But we also know that, especially in the NHS, that it has been underinvested in technology in particular. And so there's quite a lot to do in terms of being able to invest in that technology to be able to meet those needs with all the other competing demands and priorities that are put on the healthcare and social care system every single day. But it's also important to think it's not about replacing people with machines. It is about creating capacity to meet some of those unmet needs. And, you know, and Rue talked about some of those communities. Clearly there's an opportunity, but also a challenge around if they haven't got access to technology or they don't use technology in that way, you need to go back to the education piece. So there is a much longer lead time. So it's thinking about how that can be used in a more effective way. You know, within PwC, we talk about human-led, tech-powered. So I do think it is about how you bring together the best of the human medical knowledge with technology and making sure that's really important. So there needs to be more funding in research, I think.
Yeah.
There also needs to be more funding around education and training. And importantly, that trust point, it needs to be well regulated. And so again, there's quite a lot of work to be done around thinking about the regulation that sits around AI to make it safe and trustworthy for patients.
Yeah. I'd love to. I think we'll come back to the important role that business has in supporting employees, but also to your point around the adoption and the use of technology. Is my data safe? Is you know, the risk of cyber is high, so trust both from a community and patient perspective, but also what role does business play, frankly, in that wider community, and maybe we can come back to that. Rachel, perhaps to you, building on Karen's points there. It's evident, we talked about in terms of access, we talked about in terms of understanding the population and using data and the tremendous power of data in an appropriate way. The role that technology and data can play, I guess it has huge untapped potential. We're only seeing it really early adoption. What role do you see that it could play as a preventative tool with the likes of AI, frankly, and virtual wards? And how far off are we seeing this from this being just a one or two, you know, hospitals or pilots, to really being used at scale to, you know, sort of drive value and engagement across a wider population?
Yeah, I think this is a huge missed opportunity for the NHS, and they could do so much more. And the point about the technology is it empowers the patient, and it does rebalance that relationship between doctor and patient.
Yeah.
So putting patients in charge of their own data, in charge of their own healthcare, giving them access to their medical records, giving them access to their scan results, test results, that lets patients change their behavior and improve their health, you know, from their side as well as from a sort of medicalized side. I was in Israel recently. It was just fascinating what they're doing. They're streets ahead of us. So, you know, in the A&E, there was a robot showing the patients around. They had, they were making 3D printed casts for fracture patients, which were waterproof. They had even 3D printing for personalized surgical instruments, and AI-enabled systems to manage flow through the hospital. And it was just making the system work more efficiently. Everyone has an app which they can use to book appointments, get access to their test results, see their scans, and they're in control of the data. The patient owns the data. And it's the same situation in Estonia. They've got a similar patient portal that's your way of dealing with the health service, but also gives you information about how you can improve your health. Denmark does it too. But in the NHS, none of the systems speak to one another. So there are electronic patient records in most hospitals, but there are 21 different versions. And those patient records don't speak to the GP records, and patients often can't access their own medical records, even though it's about them. So I think it's partly because of sort of some in the medical profession don't like the idea of patients being empowered in that way. But there's a huge opportunity. And as you say, some hospitals and providers are doing it. So Milton Keynes Hospital I went to last week, and they're trialling a pilot to giving out Apple Watches or Fitbits to their diabetes patients. If they do a certain number of steps a day, then they will get to keep the Apple Watch. And the entire cost of this program will be funded if they manage to avoid one amputation as a result of diabetes. So the cost savings are enormous potentially, and there's a huge untapped resource there that could be harnessed for the benefit of patients and the economy, but also for the benefit of the NHS.
For sure. And it's fascinating how, to that point around trust through the pandemic, that idea of an incentive. So as we all ran around with our NHS apps and demonstrated that we had, we would go on the app and show it to people and scan it to go into shops, or if people were traveling, they would. So I think there are great examples, some that you've mentioned there and some at scale, where there's an incentive, where the data's appropriately secured, where it can be adopted across a larger population. But I think the point about, as Karen said, that sort of technology underpin, but actually this is all about people adopting and using and feeling confident in how they use the technology, and that they can trust it, and that the data is secure and so forth. I think that's a super important point. I guess maybe just building on that and coming to perhaps to you, Roo. We've talked about the opportunity that technology has to break down barriers to service around virtual consultations, was something that we heard from there. It also has the potential to exclude people, frankly, also on the negative side of things, where perhaps they can't afford it, or they have difficulties using it. Whilst we clearly can't, let that slow down advances and innovation and the drive to service or meet the needs of underserviced communities. How do we ensure some of those risks are minimized and technology does benefit all? Perhaps that one to you, Roo.
Thank you. So yeah, I mean, I'm fascinated. I was sat listening to Rachel describing that A&E department in Israel. I was writing down all of the different things that they've got available to them for me to go and look up, and it's making me think about just how complex and diverse the technology conversation is in the context of healthcare, and how actually have we brought the two together in a standardized way. And so, for example, when I talk about digital exclusion in my role around health equality, one of the conversations one of the things that I would start any conversation with is, are we talking about the same thing? So when I talk about digital exclusion, does that mean the same thing to me as it does to the people I'm talking to? Digital inclusion, digital capital, so making sure people have access to the hardware and the tools that they need to access the technology. And so some of this goes back to knowing what the problem is that you're trying to solve, and recognizing that there may be more than one way to solve that problem in terms of tech, and then working out which of those solutions works best for which group of people. So, for example, in the area that I work in, we know that one of our counties that we look after has some of the slowest broadband speeds nationally. So offering out loads of virtual appointments to patients from that particular area, even if they want to engage with it, is going to be really challenging. But we didn't know that until we did some work around the census. So I think understanding what the problem is, understanding what your enablers are, understanding what your barriers are really important. And I do think there is something about how do we bring healthcare right into the 21st century in the context of Britain and the way in which our healthcare system is set up. So it's fascinating to me to hear about all of the different options that are out there, but how do we make it relevant and applicable to the healthcare system that we have? And then how do we make it relevant and applicable to the populations? And for me, that goes back to who is it that we are trying to help and what is the problem that we're trying to solve?
Yeah, perfect. And then, you know, and doing that in a way where people can trust it, but also access it, and make sure there's equality of access as well. Look, fascinating, and I could sit here all day. So we have a few minutes left, and I'd love just to come back through the panel and hear from you. But clearly, you know, some fantastic observations there around what we can learn from outside of the UK. I mean, there's some, you know, the Israel example that you were giving, the huge importance and opportunity that technology gives us, but the access, both, you know, affordability of access and also, you know, making sure people can use it, but also trusting the data that's in there. And I think ensuring that really provides access to all, I think, is critical. So this is really a fundamental business challenge. It's a community and social challenge for us. There's so much more we could discuss today, but I guess I'd like to come back through and maybe to you, Karen, some parting messages, a lever or an action or something you would like to leave our audience here today with, to address this topic, and recognizing that's a fairly big question to come to you on, but to you, Karen, first.
Yeah, it's a huge question, and the example that Rachel gave about the sort of Fitbit versus an amputation is just will stay in my mind out of all this conversation, because it reminds me of something a doctor from India once said to me, was that in the NHS we seem to care more about the data than we do about the lives that sit behind the data. And I do think there is absolutely needs to be a mindset shift around thinking about how we empower people, you know, the advocacy point that Rue made, and the self-management, and empower the public to take more responsibility around their well-being and healthcare. So we move further down the prevention road. But yeah, that's a great example, Rachel. Thank you for sharing that.
Yeah, that will stick with us. Rue, to you, if I may.
So I think I would build on what Karen has said, and so for me, every conversation that we have around a change in healthcare, a service improvement, has to start with, are we meeting the needs of the most underserved population or members of the population who we're caring for? If we aren't meeting their needs, then what specific actions are we going to take to meet those needs before we make a wholesale change? Because otherwise we are just embedding and entrenching inequality and making it harder for us to do the right thing for as many people as possible.
Perfect. Thank you. And finally, Rachel.
I think, again, building on both what Rue and Karen have said, I think we've got to stop seeing healthcare as a kind of hospital situation about treatment. You know, it's almost like it's the national hospital system rather than the National Health Service often. And the resources and all the attention goes on hospitals. And we have to empower patients and encourage businesses as well to create healthier communities. And I do think business has a role in that, both for their employers, but more generally as well. And I think it's got to be about making a healthier country rather than just about dealing with the consequences of ill health.
Perfect. Yeah, couldn't agree more. And I think a perfect way to bring the thoughts from the panel together as we come up to time. So it just leaves me to say to Rachel, Rue, and Karen, huge thank you for taking the time and sharing your thoughts with the audience today. We hope you enjoyed it. I certainly did, and we hope that the audience enjoyed our conversation today. Please look out for future episodes of our Next in Health series through LinkedIn, and we'll also be recording this and making it available through our web channels. Many thanks to the panel, finally, to the listeners for joining us, and we'll leave it there at the top of the hour. Thank you.